Biggest thing we want to make sure is safety is paramount.
The Ghost Riders of Helicopter Sea Combat Squadron 28, assigned to NSA Naples, participated on a Corpsman-led combat lifesaver training exercise to increase operational readiness.
This week we've been conducting a course called Combat Lifesaver, but it's been specifically tailored towards what this unit does, HC-28, and the type of things that they would see in their environment. Originally it's medical training that's done for guys that are in combat situations, so they can actually treat their patient and increase the survivability of the patient from getting from point of injury to a higher echelon of care.
Participants had the opportunity to use skills during simulated scenarios similar to those encountered in combat. The goal was for them to experience the true nature of tactical combat first aid.
We conducted a flight as part of a combat life-saving exercise with corpsmen in which we induced a stressful environment so that our air crewmen could exercise the first aid and combat life-saving skills they learned in order to be better prepared for our search and rescue and medevac mission.
The combat lifesaver assists the combat medic in providing care and preparing casualties for evacuation from those areas where troops are currently deployed.
First aid is one of the biggest things that we focus on, because if we get a CSAR search and rescue, we're the transport to the hospital. We're going to be the evac for anybody on the battlefield or sorts like that. So it's amazing that I could do this, and now I can, when the corpsman or the medic or anybody, the medical professional comes up to me and gives me a pass down, I know what they're talking about, and I could really transition and help keep the wounds treated and until we get to where we are, and then I can effectively pass this knowledge on to the receiving medical professionals.
The combat lifesaver doctrine was developed as an effort to increase survivability in combat environments where the combat medic may not be readily available. Specialist Raul Pacheco, Naples, Italy.